morning or good afternoon. I'm Dr. Sarah Pederson. I am an OB-GYN and I specialize in holistic fertility and women's health. Today we're going to be talking about 4 ways that we can prevent miscarriage. I'm very passionate about miscarriage because we really want to make sure that we're keeping our bodies as healthy as possible so we can sustain a beautiful, lovely, healthy pregnancy. The 4 things that we're going to talk about are number 1, egg quality. Number 2, hormone balance. Number 3, your uterus and your uterus lining health. And number 4, inflammation, because these are all common causes that I see of miscarriage. The first thing I want you to know is if you have a miscarriage, please take the time to do a really big workup, because oftentimes, and I hear this all the time, somebody goes to their OB-GYN, they tell them they had a miscarriage, they want to prevent a miscarriage in the future, and their doctor says, 1 miscarriage is okay. When you have 2 or 3 miscarriages, then we'll look into it. Which totally drives me completely crazy, because you shouldn't have to wait to have 3 miscarriages to make sure that your body is okay and functioning. So do not let anybody say that to you. If you've had a miscarriage, let's please make sure that everything is as optimal as possible so that we can try as very hard as to prevent it in the future. Number 1, when we think about egg quality, the most common cause of miscarriages, and we think that up to 90% of miscarriages are actually caused by chromosomal abnormalities. But this normally is not our chromosomes as the man or the woman or the mother or the father. That's usually not our chromosomes, but it's the chromosome of the egg and the sperm together. So how do we get our chromosomes to be as healthy as possible in our egg and sperm is that we really focus on our egg quality. When we think about egg quality, the first thing that we always want to make sure is that we're eating a lot of antioxidants. The best possible thing you can do for your egg quality is eat a lot of antioxidants. Your top 3 antioxidant foods are going to be green vegetables, kale, spinach, Brussels sprouts, avocado, so those types of green vegetables. And then berries have a lot of antioxidants. And then other things like turmeric and green tea are a great way to get antioxidants. So in order to keep our eggs healthy, we want to make sure that we're eating antioxidant foods every single day to maintain our egg quality. The other thing is, if we've ever had a low egg quality, I often recommend various anti-inflammatory or antioxidant supplements to try to promote our egg quality as much as possible. Common ones include alpha-lipoic acid, resveratrol, CoQ10. Definitely don't take those things generically, taken under the guidance of a medical provider or a doctor. In general, in order to promote our egg quality, though, your antioxidant foods and your supplements are the best. And with that, sperm quality is also huge. So there's ways that we can measure our egg quality, and there's ways that we can measure our sperm quality. So just like our egg quality is important to prevent miscarriages, sperm quality is very, very essential. So if you want to prevent miscarriages from happening, you've had a miscarriage and you definitely, of course, don't want to have another one, it really is important to test your partner's sperm so that we can be optimizing his sperm quality. For him, we want to make sure that his chromosomes are good, that he doesn't have sperms that have 3 heads and 2 tails, and that he has plenty of antioxidants to support sperm with proper chromosomes. So that when the egg and the sperm come together, that we're not causing chromosome abnormalities that can cause a miscarriage. The second really important thing when we think about preventing miscarriage is hormone balance, because the whole process of making an egg, recruiting a follicle, it actually takes 4 months, 3 to 4 months. It is true that women are born with all the eggs that we're ever going to have. However, there's phases of your body recruiting those eggs. And sometimes we use the word egg and follicle interchangeably, but actually an egg is inside a follicle. And the follicle is what grows and ruptures and the egg comes out, and that's what causes our ovulation. So when we think about preventing miscarriage, we want to make sure that our whole hormonal flow is balanced, because that is what enables us to recruit those good high quality eggs. So for example, in our follicular phase, between the time we get a period and the time we ovulate, we want to have a good flow of estrogen, and we don't want to be making progesterone because we're not supposed to be making progesterone there. We want our estrogen to start off low and then go high. That flow of estrogen up until the time we ovulate is really, really important for recruiting high quality eggs or high quality follicles for that cycle and the next 3 cycles to come. Because your body will pick a dominant follicle and then it'll have other eggs in the back chamber that are ready to be ovulated for the upcoming cycles. So each month that we have proper hormone flow sets us up for success for the future months. That's why sometimes people have a miscarriage and then right after they're able to get pregnant, it's because they were on the right track of proper hormone balance. And even though that specific pregnancy didn't end up in a live baby, the hormone balance that they've been working on over many months, now they have healthy eggs in the chamber and they're able to ovulate a healthy egg the very next cycle and able to conceive and maintain a pregnancy. So cycle over cycle, hormone balance is extremely important. And then we want to have that follicular phase hormone balance be appropriate so that when we ovulate, we have a good, strong, high quality ovulation. We grow a good sized follicle. That follicle is able to rupture quickly. The egg is able to come out. It's able to travel down the fallopian tubes, meet up with the sperm, go into the uterus. That whole process, of course, is very important for maintaining a strong, healthy pregnancy, and the health of that process tries to help us prevent miscarriage. So we really want a good, lots of estrogen, strong LH surge, high quality ovulation. And then after we ovulate, our body makes something called a corpus luteum. What the follicle that ruptured and then the egg came out and then dissolves into this little squishy looking cyst called a corpus luteal cyst or a corpus luteum. And that corpus luteum is what makes estrogen and progesterone in your luteal phase. So between ovulation and your period, and that is what supports your uterus lining to support implantation and the initial growth of the pregnancy. So if we have a healthy follicular phase, good hormonal flow, strong hormones, strong ovulation, it sets us up to have a strong luteal phase. Because if you have a luteal phase defect, meaning your luteal phase is really short, or you have low hormones or a hormone imbalance in your luteal phase, meaning your estrogen is too high relative to your progesterone, or your progesterone is too high relative to your estrogen, all of those things don't allow you to have a healthy, proper uterus lining to maintain a pregnancy. So the whole flow of your hormones in each stage of your cycle is really, really important to maintain that healthy pregnancy and prevent miscarriage. Another thing that's important is that your luteal phase is healthy cycle over cycle over cycle, because you want to make sure that your uterus is growing its lining, stabilizing its lining, shedding the lining in a healthy way. Because if you're not shedding your lining completely with each period that you have, meaning you're not seeing proper hormone balance and stabilization in our luteal phase, and completely shedding your lining, over time that can build up really unhealthy layers in your uterus. And you want your uterus to have really strong, healthy layers, a really strong, healthy endometrium. You want it to be like a hardwood floor and not a shag carpet, because you want your baby to implant in a really healthy uterus lining and not an unhealthy uterus lining where we've been building up unhealthy layers and have improper hormone balance and improper shedding cycle over cycle. So hormone balance is extremely important in preventing miscarriage. The third thing is your uterus lining. And I was referencing that a little bit earlier, but when we think about our uterus lining, we want it to be strong. So we want it to have an ideal amount of estrogen and progesterone exposure to grow the cells to be very healthy. And then if we're not pregnant, we want to have a very healthy shedding of our period. So we want that period to start with healthy red flow. Not spotting in our luteal phase, no cramping in our luteal phase, no spotting or shedding before we get a period. Those are the kind of things that we're looking for. And then one thing that I see all the time that's extremely important to check for is the health of your uterus lining and the health of the cells and any markers of inflammation or endometritis. And we do this by doing an endometrial biopsy, where we'll put this little tiny coffee straw in your uterus, take some samples of your uterus lining, which is called your endometrium, and then send that off to the pathologist. They look at it under a microscope and they determine how healthy the cells are, if there's any evidence of inflammation, and if there's any evidence of infection. Because if we're going to try and prevent miscarriage, we want that uterus lining to be as beautiful, healthy, thick, low inflammation as possible. And if we find anything, those are absolutely things that we can fix. So we want to make sure that our uterus lining cells are healthy, the uterus lining is getting thick enough to support a pregnancy, the hormones are high enough to support a healthy uterus lining, and that the uterus lining is not inflamed or infected. So these are all things that we can test for and optimize to make sure we have the absolute healthiest uterus we can to support proper implantation. And then the fourth thing is inflammation, which is very big kind of catch-all term. However, any inflammation that we have anywhere in our body can affect our ability to ovulate, make high-quality eggs, can affect our ovaries' ability to make hormones in proper amounts, and can affect the ability of the egg to travel down the fallopian tubes and implant in the uterus. Because if our ovaries are inflamed, if our fallopian tubes are inflamed, if our uterus is inflamed, it can really affect the body's ability to make hormones, ovulate, and implant a healthy baby. So when we think about inflammation, you want to think about inflammation anywhere in your whole body, because that can really be related to your uterus. For example, I often check patients to see if they have any autoimmune disease or pre-autoimmune disease to make sure that there's no internal sources of inflammation that we need to be working on. And there's lots of different supplements, steroid protocols that we can put you on to really calm down that inflammation as much as possible. So autoimmune disease is something that I see really commonly. That's something that we can really calm that inflammation down. Another thing is gut disease. So I often do gut health tests on patients, and we find a lot of inflammation in the gut. And those are things that we need to dig into. For example, is there an infection inflaming your gut? Are there certain foods that are inflaming your gut? And we need to do some food sensitivity tests to make sure there's no foods that are causing inflammation. Because when you think about your anatomy, your intestines are actually covering and bathing your entire uterus, your fallopian tubes, your ovaries. So if you have inflammation in your gut, that inflammation can pour over into your uterus, ovaries, fallopian tubes, especially if your gut is leaky. And they can share and pass back and forth different bacteria. And so gut inflammation can have a huge, huge relationship to uterus inflammation. And then other sources of inflammation, of course, we talked about your uterus lining, so endometritis, infections in the actual lining of your uterus, or inflammation in your vaginal tissues, meaning you want to make sure that your vaginal microbiome is healthy and that your vaginal tissues are not inflamed. Other causes of inflammation that are common is things that just don't make you feel good. So when you get sick, if you're really, really sick, that's inflaming your body. Or even just getting a cold or a really bad strep throat, something like that. Oftentimes we can do advanced infectious profiles to make sure there's no underlying viruses or bacteria that's chronically inflaming us. And you want to make sure that you don't have any things that where you've gotten sick in the past and then your body just quite hasn't healed it. So just general sicknesses is very important, and allergies is a big, big one. Allergies is a huge source of inflammation. So if you're allergic to something, even if it's things like air, pollen, dogs, cats, hay, grass, you really want to make sure that you're working on lowering those hits to your system so that your allergies are not chronically inflaming you all the time. So lots of different areas of inflammation that we look for, because if you can keep your inflammation as low as possible, that can definitely help prevent us from having miscarriages. Because now, if our ovaries are not inflamed, then they can ovulate better, our eggs can travel down our fallopian tubes, and they can implant. So when we're thinking about preventing miscarriages, things that we want to optimize for are our egg quality. We want to keep our eggs as healthy as possible. We want to make sure our hormones are as balanced as possible. We want to make sure our uterus lining and our uterus in general the cells are healthy and they're not inflamed or infected. And then we want to think about full body inflammation or other systemic or full body illnesses. Are we keeping our general cells as healthy as we can so that our uterus and ovaries can function like they were designed to function? So thank you for joining me on this episode of Hormone Café. Next time, we'll be digging a lot more into egg quality. What does that mean? So join us for our next episode and have a beautiful day.